4 tips for how anyone can save money on healthcare costs today. I was 28 years old when I had the most major health incident of my life. It was a couple years ago when I was skiing at Whistler Mountain in Canada with some friends and I took a spill. It didn't seem like much of a fall, but my ski twisted and suddenly I was in the worst pain I'd ever felt. I couldn't walk. I had torn the ACL, MCL, and meniscus in my right leg. It was a potential nightmare, a bad accident in a foreign country, and no health insurance. I know, sounds like a recipe for financial disaster and a mountain of medical bills. I had emergency transportation off the mountain and then urgent care in Canada. I had several visits to an outstanding orthopedic surgeon, an MRI, surgery, a couple fancy braces, and 8 weeks of physical therapy. But you know how much all of that cost me? Only $250. That's it. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that make your life better. I want to share with you 4 simple tips on how to save a lot of money on your family's healthcare costs, including the way I only paid $250 for all that medical care. I'm on a mission to help as many people as possible stay healthy and pay less for healthcare, and these 4 ways are just a few of the easiest I've found to save. I've personally tried every one of them, and they will work for anyone, regardless of whether you have health insurance or not. But first, you have to start thinking about healthcare like you do any other purchase you make, like a budget-conscious consumer of any product or service. You see, a long time ago, the real customer got totally removed from the health benefits conversation. When was the last time you price shopped your doctors, nurses, or hospitals? Now, you might say, why would I care about the cost? My health insurance pays for it. But sadly, that's not the actual truth. In reality, you pay for the vast majority of your own healthcare because you haven't met your health insurance deductible, or because of the copays, or because you're on the hook for your health insurance premiums every month. Once you start thinking about healthcare, not just as a patient, but also as a consumer, there are better outcomes ahead. Tip number 1. Pay cash or credit for routine healthcare. Did you know that most people reach their health insurance deductible once every 7 or 8 years? If you have a high deductible health insurance plan, that means that the insurance company is just collecting your money and paying virtually nothing that whole time. And up until you do reach your deductible, you're out of pocket whatever amount your insurance company agreed to with your provider. And here's the kicker. The negotiated rate is never really the lowest price for care. Let me give you an example. Several years ago, I started getting migraines. Nothing crazy, but my primary doctor suggested I go get it checked out by a neurologist. The neuro asked me to get a CT scan just to rule out anything abnormal going on. They directed me to a nearby diagnostic imaging place, so I gave them a call, and the first question was, well, what's your insurance? Now, I thought I had great coverage with a good insurance company, no scary high deductible, and then they hit me with the news. The scan was gonna cost me around $2,000. I must have given away my sticker shock because the woman on the phone said, hang on just a minute. When she came back, she said, I just talked with my office manager, and if you wanted to pay by cash or credit card, then the price would only be $400. The exact same scan in the same facility just got reduced by $1,600. That's huge, so I thought it must be too good to be true. There has got to be a catch. Turns out there's one small downside. By paying $400 cash instead of using my insurance, that payment wouldn't count towards my deductible or out-of-pocket max. Still, saving that much money out of pocket was an easy decision to make. I was pretty certain that my migraine care wasn't going to turn into anything more expensive, and even with a few more visits to the neuro, wouldn't get anywhere close to my deductible. I was better off paying cash, even though the insurance company would not give me credit for it. Tip number 2, utilizing telemedicine services. How many times have you just needed a simple refill for a medication? Something you've been taking for years. You call your doctor's office and you get the dreaded, well, we need you to come into the office to get that refilled. We all know that calling in a refill to your pharmacy makes the doctor absolutely $0. Okay, sure. Maybe they might need to make sure that you're still getting the desired result on that medication, maybe check you for side effects or adverse interactions. Sure, but do you really need to go all the way into their office, deal with a crowded waiting room full of sick people for 45 minutes after your appointment time, just for 2 minutes with the doctor and your refill? No, there is a whole new crop of specialized telemedicine and virtual care apps that focus on delivering near real-time health answers, medications, and whatever a patient might need. It's not only convenient, but specialized and very affordable as well. Many of them can also ship your medications directly to your home for a low price. Or, if it's something that you need more immediately, such as an antibiotic, they can call it in to your local pharmacy. Tip number 3. Speaking of medications, always shop medication costs. One of the easiest ways to save money is by shopping for the cost of your prescription medications. You've probably seen ads for GoodRx. They are one of the most well-known prescription drug discount programs and the best I've used so far. But there are a number of these drug programs designed to help you save on prescriptions. Results will vary by the drug and your location. When you get a prescription from your doctor, it's easy just to go on their website or app and search the prescription, strength, and quantity. Most of them use your zip code to pull up pharmacies in your area and what the prices will be with their free coupon. Many times, a few extra minutes drive time to a different pharmacy down the street can save a good chunk of change on your cost to fill the prescription. Tip number 4. Medical cost sharing. Remember how I told you I only had to pay $250 out of pocket for the whole skiing injury? I know that sounds totally nuts and hard to believe, but it's exactly how it happened. It went that way because instead of paying through the nose for health insurance, I had chosen a medical cost sharing plan. I paid about half of what I was paying for a traditional health insurance plan with Blue Cross that came with a high deductible and an out-of-pocket maximum that most folks could never afford. Every time I tell people this story, people always ask me how it works and why it's so much cheaper. When my incident happened, I was expected to pay an initial unshareable amount before the medical cost sharing community would share in the rest of my medical bills. This IUA, as they call it, works a lot like an insurance deductible. The whole time I did exactly what I told you to do at the start of this video. I asked for the cash price for the office visits, scans, even the surgery center gave me a cash price. As you might expect, eliminating the health insurance from the picture caused the prices to shoot way down. In one instance, the anesthesia bill was reduced by almost 80%, just because I presented myself as a self-pay customer. And bam, there's your answer and why healthcare can be so much cheaper than most people know. Another thing that blows people's minds about medical cost sharing is that there's no network to worry about. Even though I was up in Canada when I got hurt, all of the bills were still shared. And once I got back home to get my knee fixed, I was able to pick the orthopedic surgeon I wanted, who was recommended by a trusted family friend. It was so nice because I didn't have to worry that the surgery center or anesthesia group might be out of network and hit me with a surprise bill. Everyone has heard the stories of people going in for surgery, using their health insurance, only to get an ugly out-of-network bill just because a provider involved in their care was not in their health insurance network. This simply doesn't happen when you have the right medical cost sharing plan. Now, for me personally, I've been a medical cost sharing member going on 7 years now, and it's been one of the best decisions I've ever made. I've saved huge money on my monthly payments during that time, and it works so much better than old style health insurance. But like most things in life, medical cost sharing isn't for everyone, because we're all different with unique health needs and financial concerns. I'd say on average, it's an amazing solution for about 85 to 90% of people who are generally healthy and looking for a more affordable way to protect against the big bumps in the road of life. So if you're curious and want to learn more, make sure you click on the link below to get in touch. I'm happy to tell you anything you want to know about my personal experience with medical cost sharing. It's been awesome for me, and maybe I can help you to decide if it's good for you too. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share the video with your colleagues and friends.